I'll tell you what, they're myriad in nature, right? Whenever we're dealing with older adults, and they have neuropsychiatric conditions, they're oftentimes going to be a little bit frailer in that there's going to be medical comorbidities, and there's oftentimes going to be a higher susceptibility to certain problems. Among those things would be things like, for example, falls or movement problems like Parkinsonism, that are tied into the utilization of different medications to help offset certain symptoms, whether that be agitation, psychosis, or otherwise. So the interesting thing is that whenever we are having to make an intervention with somebody that's older or frailer, we have to take into consideration that they're oftentimes going to be taking other medications that might have different types of side effects. They might have medical comorbidities that might then subsequently aggravate or enhance or potentially set up a situation whereby people have a little bit more problems from a tolerability point of view. In addition to that, we also have to take into consideration their cognitive status, right? So when somebody's a little bit older, they're probably a little bit more susceptible to memory problems. And as a consequence of that, that becomes a bit of an issue as well. So there are multiple factors to take into consideration. We were super excited to share this information because obviously this trial was set up in such a manner so as to be able to compare placebo, an inert substance, in frailer older adults and elderly patients with, as you said, NDD or neurodegenerative disorders with neuropsychiatric symptoms. And these could have included hallucinations and delusions. And it was more than anything set up to take a look at the safety profile of pimavanserin. As you may be aware, pimavanserin is the only medicine that's currently FDA approved to treat, Parkinson's disease psychosis, which, is a non-motor symptom associated with Parkinson's, but can be associated with a lot of distress in people. We screened a lot of people. So the important thing of this study is that close to 1,500 people were screened. So to be precise, it was 1,440 people. And, out of these individuals, 730 people completed the study. And the neat thing was that when you take a look at the overall results, the treatment emergent side effects were similar between the two treatment groups. In other words, we treat somebody with, again, the medication, pimavanserin, compared to placebo, and we find a very similar treatment emergent side effect rate. That's great news, right? And the other very important piece was that pimavanserin did not impact any motor or cognitive related function in these patients, which is phenomenal news, right? We were in addition to that, taking a look at some secondary outpoints, looking at what was happening with suicidality, sleep quality, neuropsychiatric symptoms, and all around, pimavanserin had a very favorable profile. So that's important, right? Because oftentimes antipsychotic medications are utilized off-label to treat the neuropsychiatric symptomatology in patients that have neurodegenerative disorders. And oftentimes these interventions lead to falls, Parkinsonism, death. So that's not great, right? So obviously any type of information that might help us along the lines of looking at things that are better tolerated in older, frailer adults helps us greatly. And so, the other nice thing is that it wasn't just Parkinson's disease with or without dementia that we were looking at. We were looking at other forms of dementia as well. And this could have included Alzheimer's disease, Lewy body, other dementing conditions that we run into in the clinical setting. You know what? Well, there's always going to be pros and cons, right? So the important thing is that, obviously the big news here is that we had a lot of people, and this was phenomenal. There were a lot of different sites in different parts of the world. So this was a global study, and the other great news is that, patients that completed this portion of the trial were allowed to roll into a 1-year study. So this is important, right? Because the study was 2 months in duration, although study duration could have been up to 16 weeks based on, screening and making sure that everything was going to be cut out for everyone. But bear in mind that, when we take a look at, overall strengths and limitations, there's always going to be different factors that we take into consideration, right? And among the other things that we might want to look at as potentially being, somewhat limited, um, you know, uh, the overall issues associated with, having a medication that's only indicated for Parkinson's disease dementia at the present time, but obviously having a high degree of interest of further understanding the overall safety and tolerability in other populations beyond Parkinson's disease psychosis, with or without dementia, would probably be, one of the important things, right? The important thing is that, pimavanserin was super well tolerated. It wasn't associated with cognitive decline or motor dysfunction. And in a patient setting such as this, patients with neuropsychiatric symptoms related to their neurodegenerative disorder, that's always going to be great news. The most important piece is that the safety data here is pretty consistent with what's already been well characterized with different trials that have been done by pimavanserin. And that'll help us so that when we treat our patients, we'll have a safer margin of consideration, particularly where the drug's currently FDA approved in the US, and that is with patients with Parkinson's disease psychosis, with or without dementia.